on Disability Services. As always, I'll start with our data. I need to switch to slideshow here. So we did have some additional people who were diagnosed with COVID this week. So our total number of people who have been diagnosed with COVID is 414. And by placement type, you can see in host homes, it is 6, intermediate care facilities, 114, mental health facility, there was 1 person, in natural homes, 50, in nursing homes, 2, in out-of-state placements, 4, in residential habilitation, 37, and in supported living, there have been 200. And so within each of those, not each of those, but within our major different placement types, what you can see is that in ICFs, those 114 people represent 38% of people in ICFs who have contracted COVID. And of those, 10.5% or 12 have died, and it was confirmed as COVID related. They have amongst the people.
Director Reese, can you show the PowerPoint slides? They're not showing on our side.
Oh. Okay. Sorry about that. Oh, someone probably sent me a note saying that. And I can only see what's in front of me.
We can see it now.
We're there now, right?
Excellent, thank you.
Okay, thank you. Yeah, maybe someone was discreetly sending me notes, but I can't see while I had that in front of me. Very sorry.
Many people sent you that.
Yeah. Well, I was only looking at the slides, apparently all by myself. So as you can see, we're looking at infection rate and death by placement type. In intermediate care facilities where we've had 114 people who've tested positive for COVID since the beginning. This represents about 38% of the people in ICFs who have contracted COVID. And of those, 10.5% or 12 have died, and it's been confirmed that they died from COVID. We've had additional deaths of people who had COVID and subsequently died, but in many of those instances, it has been confirmed that it was not directly attributable to COVID. There have been 22 people overall who have died, who had COVID, who were in ICFs. In natural homes, we have had 50 people with COVID, which represents about close to 5.4% of the people in natural homes. And of those people who have contracted COVID in natural homes, about 10% have died. In residential habilitation, there have been 37 people who've contracted COVID, which represents about 34% of that population. And amongst those, 2 have died that it was confirmed as COVID. 1 additional person did subsequently die. So that represents confirmed COVID deaths of 5.4%. In supported living, we have had 200 people who've been diagnosed with COVID, which represents about 21% of the people in supported living. And of those, 19 have died, but only 14 have been confirmed as COVID deaths, which would be about 7%. And so overall, for people supported by DDA, we have had 17% of the people, or 414, who've contracted COVID. 52 people have died. However, only 35 of those are confirmed as COVID-related deaths, representing 8.45% of the total. So by month, what you can see is that in March, the 5 people who have contracted COVID represent 4 people who were in supported living and 1 in their natural home. People who've required inpatient treatment by month of diagnosis, they're all 5 people who contracted COVID in March have not required inpatient treatment. The 1 person in February is still hospitalized. So people diagnosed with COVID who have died, as I said, there have been 52, including 1 death in March. That death was a person who had contracted COVID a number of months ago and recovered. So it is not clear, or certainly not confirmed at this point by OCME, that was a COVID-related death. Of the 52 people, 11 have been confirmed by OCME as not COVID-related, and we are still awaiting confirmation from the medical examiner, either in DC or Maryland, of the cause of death for an additional 6 people. And so the total number of people who have died that is attributable to COVID directly is 35. And lastly, within our provider agencies, 660 provider staff have tested positive for COVID-19. 48 of these staff work for more than 1 provider, and sadly 10 staff have died from COVID. The 660 represents an additional 3 people this week. So we are seeing some improvement in those numbers as well. So we did have 2 vaccination days this week, 2 clinic days where a number of people were able to get vaccinated. That's the good news. We have scheduled 2 days next week and 2 days the following week. The nurse supervisors here at DDS have been working with the directors of nursing in the various programs and with service coordination to plan for this. This week had a few more bumps than our prior clinic days did. So we just wanted to provide some reminders, which we'll also send out in writing ahead of our next days, just as a reminder to folks. People are given an appointment, and so only people who have appointments should show up to get vaccinations. Apparently, there were a number of additional people that showed up on the first day, and actually somehow many of those did get vaccinations. But, you know, it would be very unfortunate to have people at the end of the day not have vaccinations left because people who didn't have appointments showed up to get them. So it's very important. Also, not everyone showed up at their appointed time, including, unfortunately, 1 person who was only 15 minutes late, but their appointment was the last one of the day. And when they arrived, the provider said, you know, we can't pay our staff overtime and we are now out of time. So you're going to have to schedule this for another time. Fortunately, someone was able to help that person schedule for another day, but it's really important to get there a few minutes early for your appointment so that you are on time. The nurses have been providing people information about what to bring with them. And as I said, we'll make sure that written instructions go out, but it's important to bring the documents you're going to need so that it's a very smooth process. I know that the first clinic we had, I was able to go there and spend a few minutes during one of the days, and it was a very smooth process. It was quite impressive. It was really nice coordination between Giant, Department of Parks and Rec, and Howard University Hospital. So I'm hoping going forward, we'll see that same kind of coordination. The other thing we saw was that one provider had scheduled a large number of their folks, and they sent a staff person to be there on the ground to make sure and coordinate everything. And that was very helpful. If someone is going, it's helpful to make sure that there's someone there that knows what the process is and can help walk people through that. So just some notes for next week and the week after. As a reminder to people, this is not at all the only way that people can get their vaccination. I spoke about it last week. I thought I tweeted about it, but I haven't seen that tweet. I was able to get my vaccine this week. I have known more and more people who are able to get a vaccine. I would really encourage people to go to the coronavirus.dc.gov website, and then Vaccinate DC is the tab. There's not a tab. You have to type the whole thing in. And for one, you can now register so that you will get an email from DC Health or you'll get an email when you're up to get your vaccine. So a number of people were able to register this week, and some of them will be getting an email saying it is your chance to schedule an appointment. Please come in for a vaccine. So what they do is look at, are you now eligible? And if you are, then randomly they select people from different categories and then allow people the opportunity to schedule a vaccination. What you'll also find on that website is a list of, which I went over last week, hospitals and healthcare providers through which you can also register to get a vaccine. And what I would recommend is that every one of those avenues that applies to you, you register for. So, if you are connected to GW's hospital system and, if you've been to Sibley, so you're in the Johns Hopkins system, and if you've been to any MedStar facility and you're in that system, register for each of them. If you get your care at any of the health centers that are listed below, register with them. And when your name comes up on their list, you can then pull yourself off the other lists. But while it is still true that there is still more demand for vaccine than there is vaccine, we are seeing improvement in that. And I am hearing from a lot of people who are eligible, who have been able to get their vaccine. I'll also say, maybe someone said it's a smaller needle. Easiest shot I've ever had. Just so people know, if you have issues with shots, and maybe one of the DC Health people can explain that, but it really did seem to me that this shot was like less than the flu shot I normally get. It felt to me, maybe I'm wrong, and maybe it's because people built up. Do you feel pain? But at any rate, that went very well. And our hope is that it goes that well for all the people we support and for all of our provider staff. All of these mechanisms are available for people to sign up so that you can get online to have them schedule your vaccine, and please do so. As vaccines are becoming available, we're starting to hear the CDC talk about what does it mean now that people may be fully vaccinated. And just as a reminder to people, the guidance in the district is DC Health guidance that would be based on their review of CDC guidance and applying that information to the facts on the ground in the district. And I will just say, you know, with knowing people who've gotten a vaccine, with seeing all the news about vaccine freeing up recently, I feel very hopeful about where things are. And still, we need to make sure that we continue to take all of the safety measures that we've been taking. We've all made it this far. We have to make it to the end. And the way to do that is to continue to use all of the mitigation, all of the protection that we've used all along to get us this far, which means continuing to wear masks, continuing to maintain a safe distance, continuing to wash your hands regularly, until we hear otherwise. While we've heard about a lot of people getting vaccine, the percentage is still not up to a point where, you know, it's where you certainly are anywhere near this, what they keep talking about, herd immunity. It's good that we're starting to hear about it coming out, but we have got to maintain, we have to maintain these safety measures. And maybe DC Health could talk about, I know last week they presented changes in their guidance. I'm pretty sure there's been no change this week, but if they could talk about sort of where the guidance is at this time.
Thanks, Director Reese. This is Daryl Hawkins, and my other colleagues, Nelson Benucci and Andrea Coker, are on the line. We're from DC Health Healthcare Facilities Investigation Team from the Epi and Surveillance Branch. And, you know, we want to take this opportunity to address, you know, probably a lot of questions providers may have after the recent updates from CDC that they provided for fully vaccinated individuals. And as Director Reese already really well stated, that as a reminder to all providers who are licensed by DC Health, so that includes ICFs, Chapter 35s, as well as supported living and adult day program providers, we please continue to follow the DC Health published guidance. DC Health continues to review, as Director Reese stated, both national and local data and the most current scientific evidence when we make any changes or revisions to our guidance. And as that continues to change from DC Health, we encourage all the providers on the line to regularly check coronavirus.dc.gov/health guidance. I'll put that in the chat, bookmark it, keep it, and keep looking to stay up to date on any changes. And as usual, you know, we want to thank DDS for providing us an opportunity to continue to join these Friday calls so that we can answer any questions and provide information to the provider community. And just some reminders, because we get a lot of questions. One, for persons supported in ICF, CRFs, and supported living facilities, guidance on quarantine that is currently published from DC Health continues to be 14 days from the date of the last exposure to a person positive for COVID. 14 days of quarantine remains the most effective strategy for decreasing the transmission of COVID-19. Guidance on visitors remain unchanged. So for information on visitation in a CRF or supported living facilities, that can be found in the guidance that's posted on our website. That hasn't changed. Indoor visitation for ICF settings can be found. It has a very specific guidance for that. It's titled Indoor Visitation Requirements for Intermediate Care Facilities, also found on our website. And as Director Reese said, you know, while we are all feeling hopeful about the updates for fully vaccinated individuals, we want to remind all providers that many of these updates apply to community settings. We have seen, and as Director Reese presents very well on all these Friday calls, the data updates, the population we serve in the DDS community has a higher risk for severe disease and death from COVID-19. And because of this, we want to continue to emphasize the importance of maintaining infection control and prevention practices. So that means continuing to wear the required PPE, mask and eye protection for staff who work in these settings, social distancing, frequent hand hygiene, cleaning and disinfection practices, and continuing to have those really important conversations with your person supported and staff on the benefits of getting vaccinated. And you know, finally, you know, earlier this week, you know, the DC recognized the 1-year anniversary of the first COVID-19 diagnosis in our city. That was March 7th. And I know it's been a long road for many of you. It has not been easy, and we want to thank everyone, all the providers on the call, and really everyone in the district for all the hard work and dedication throughout this year, and your continued efforts to keep your staff and person supported and the DC community safe. That will hopefully continue to keep us progressing safely to the finish line of this pandemic. So, and we are happy to take any questions. And again, thank you for having us on these calls to help provide clarity on our guidance. Thanks.
Well, and thank you for being here each week. You know, as we move through the pandemic, there are weeks that the DC Health's expertise is needed and extraordinarily helpful to us, so that we can educate people rather than having to go back and get the answer and come back the next week, which is what we will do with this first question. So there is a question here: how do ICF numbers compare with DC nursing homes? Do we know? But I do think that we can find out. And so, and it may be that someone does know, but we will look, and I can provide that comparison next week, I believe, because I'm pretty sure I've read the nursing home data broken down by facility. It's just a matter of finding it here. So we will get some of that information and present next week. We did receive some questions this week, so I'll go over those. And then as a reminder, if people have a question, you can type those, please, in the chat box, and make sure that you direct the question to everyone. The default is often not everyone. It usually, like I know on mine, it first comes up saying to all attendees. Please scroll all the way down to the bottom where it says everyone and click on that. So we have answers. It hurts to emphasize the answers. If all members of a home and all direct support staff providing care have been fully vaccinated, is the same level of PPE required on a daily basis? Yes. As Daryl just said, none of the guidance from DC Health has changed yet. And so it's excellent that everyone has been vaccinated, and that will be a factor as the guidance is updated, but it so far has not been updated. And so there should be no change at this time in people's, particularly in staff's requirement, the PPE requirements for staff. If a person receiving services has been fully vaccinated and they are exposed to someone who tests positive, is their quarantine requirement shortened at all? And I thought Daryl just answered that, but perhaps you could answer that again.
Yeah. So I think as I mentioned, for any person supported in ICF CRF supported living facilities, quarantine remains 14 days from the date of the last exposure. However, I know some of you may provide support to those in their natural homes, etc. So those individuals that are not in ICF CRF Chapter 35s or supported living facilities should follow the community quarantine guidelines, which are also posted on our website. So hopefully that answers the question. It depends on who that person supported is and what setting they're in. But again, to reiterate, ICF, CRF, supported living facilities, person supported who are in those settings, 14 days continues to be the most effective strategy for decreasing transmission of COVID-19 in those populations.
Thank you. If a person receiving services has been fully vaccinated and wants to spend time with their family members who are also fully vaccinated, should they still mask, social distance, try for outdoor visits with their family members? I think, just to repeat, guidance that I'm aware of has not changed. And so the answer would be whatever the current guidance says is what should occur.
That's correct, Director Reese. And if any of those visitation guidances do change, it will be updated on our website, and we will share that and communicate that on these calls as well.
I have a daughter in supported living. I understand that DDS has arranged for people in supported living to receive the vaccine. The health and wellness unit should contact provider's director of nursing. Is there a deadline for them to schedule this? They have been scheduling them all along. They've worked with the directors of nursing to identify sort of priorities for scheduling people. And as I said, they've been working on scheduling next week and the following week, 2 days each week. And as a reminder, that is not the only way to get a vaccine. Everyone who doesn't have a vaccine yet, especially, so if you go to coronavirus.dc.gov, what it will say is if you are in any of these groups, you should register. So anyone supported by DDA would be a person who is eligible at this point to get a vaccine. Anyone 65 or older, anyone who's in particular jobs, including all DSPs, they are all eligible and should all be registering on that website if they don't yet have a vaccine. In addition, before you scroll all the way down to the bottom to click on registering there, you will see all of the other options for registering to get a vaccine. And so please, as I said, try every different method there is. Our goal is to get as many people vaccinated as soon as possible. I think there were additional questions. I'll go ahead and read this last question, and I believe I've already answered it, which is, I understand the dates are the 16th and 17th. What happens if all the slots get filled up? Will DDS arrange for additional days? With a large population of people, why were there only 2 days allocated? If the provider's director of nursing hasn't been contacted, should they reach out to get to the health and wellness to get this process started? Our health and wellness supervisory nurses have reached out to every provider director of nursing. So if there is a director of nursing that says they haven't been reached, they should definitely reach out to the health and wellness nursing supervisor that they work with. As I said, there are a number of different ways to get the vaccine. So we are in scheduling these clinic days, people shouldn't believe that they should wait for assistance through this coordination between DDS, DC Health, and Giant to get their vaccine. They should be taking all of the steps. Anyone who has a provider agency working with them, and we know that many have already taken advantage of this, should be taking the necessary steps to identify how they can get a vaccine and scheduling that. So, these clinic days are not intended to cover 100% of the people we support. There are a lot of other resources that we know people have been taking advantage of and should continue taking advantage of. And we will still we'll continue working and coordinating with DC Health on making sure that there are the resources necessary for all of our folks to receive the vaccine. Someone asked if we could repeat the information on how to register. So I will, as soon as I find everyone here. So I'm putting that, I think I just put that in the chat. So you can go to coronavirus.dc.gov/vaccinatedc, and you will see the information about registering for the to get your vaccine. I do see a note here that says that DC Health has started giving the Johnson & Johnson vaccine. That's wonderful news. I was hoping myself for a single shot. Someone says, I noticed that a few of the tech seminars are the same time as these meetings. Some of the same people need to access both events. Can you change the ones that conflict with the Friday noon meetings?
Hi, Andy. I can respond to that. Hi, everyone. It's Crystal Thomas. We had Donald Clark last week present on our upcoming webinars for Tech First initiative. And right now, we're unable to change those dates because we are coordinating with 18 facilitators between webinars between next week through August. I wanted to inform everyone that all of the webinars will be recorded, as well as our forums. So I believe it may be 2 or 3 webinars that overlap with our Friday forums, but both are recorded. So just wanted to let everyone know that, but unfortunately, we're not able to change the dates and times at this time.
Thank you. So can you discuss whether a person is considered over-resourced if they exceed their eligibility amount given the additional stimulus monies? Are they given additional time to spend down the funds due to COVID, as we are not clear? So as we explained, when the first stimulus checks came out in like May or June, those do not count towards your assets until 1 year later. And so people are given that amount of time to spend those funds. And so, you know, I hear stimulus checks are going to start going out as soon as they said, as soon as this week. But we don't know when we will receive them. I'm answering the question I expect to get from people. But as we receive them, we then send the money over to OCFO, and it is deposited into people's account. And once it is, people should really be meeting with their team to identify what are some constructive ways, for example, perhaps technology, that I could spend these funds. So there is a $1,400 check coming to a number of people. And so people really will need to be planning how to spend those, but they will not count toward assets until you've had them for a year. But keep in mind, if you haven't spent last year's stimulus check yet, you're coming up on a year, and that planning is now much more urgent. I don't know if we have Karen here today. There's a question about which vaccines are given where. Does DC Health give the Johnson & Johnson vaccine? Because their coworker just got confirmation that they will receive Johnson & Johnson, which, you know,
I'm here. Hi, Director Reese.
Great. Hello.
So DC Health has begun to order Johnson & Johnson. Right now, there's just one pharmacy, I believe it is Safeway, that is going to have this for the time being. With the pre-registration portal on our website, and I apologize because I don't know if it has been implemented yet, but you will have the opportunity to select if you have a preference which vaccine. So for the people that are just want that one shot, that Johnson & Johnson is a perfect option. Right now, we are expecting to get an increased supply of Pfizer. So that will probably be the default if you do not have a preference. But the Johnson & Johnson is going to be available at that vaccine. And hopefully, as we move forward, Johnson & Johnson will be the vaccination that will be given to traveling independent pharmacies for going into said facilities and things of that nature. So just keep an eye out on the website for those updates. And just like you said, just do the pre-registration if you desire the vaccine and have not yet gotten it.
What is the time frame for DC Health guidance update as our providers who work diligently to ensure further protection through vaccine for both the people they support and all of their employees?
I can take that one, Director Reese. This is Nelson from DC Health. I also work on the guidance team, and what I can tell you is we are diligently working at updating these changes and recommendations as quickly as possible, while also evaluating all the evidence and making sure that what we're doing for the district makes sense for our setting also. And so we're being very, systematic in the way that we are updating these guidances. Some of the updates, we are kind of limited to, when the CDC releases guidance, there's a lot of times that they'll tell us that something's coming in some of our meetings, and sometimes it comes out, the same week, sometimes it comes out a month later. And so it's really, it's difficult to know because the CDC also wants to make sure that the guidance that they're providing also, makes sense and is in line with the science and the data behind it also. So the real answer is we don't know, but I can, assure you that as those recommendations come in, that we are standing by waiting to evaluate those and update our guidances as quickly as possible.
Thank you. Can DC Health provide more information for DSPs that test negative but are still mandated to quarantine at home for 14 days? I understand there's a waiver for people that have been vaccinated. More clarity on this would be appreciated.
This is Daryl Hawkins from DC Health. For DSPs, so any healthcare personnel, we have updated the guidance for healthcare personnel, work restriction and return to work guidance, and that was updated on March 2nd. And as far as it pertains to vaccination, that guidance states that as a strategy to alleviate staffing shortages. And so if a facility has staffing shortages, they may elect to waive work restriction requirements for any healthcare personnel who had an exposure if these things are happening, which is one, they've been fully vaccinated against COVID-19. And the way we define that is defined as 14 days or more after the receipt of the second dose, if they got the 2-dose series, or after the 1 dose of a single dose vaccine, like the Johnson & Johnson. So 14 days after that, we consider them fully vaccinated, and is within 90 days following the receipt of the last dose, and that they continue to remain asymptomatic. Then those staff could continue to return to work if your facility is doing so to alleviate staffing shortages. Any person who works in these settings, however, that have symptoms or has tested positive must remain restricted from work, regardless of vaccination status. Thanks.
Any idea on how the new money for HCBS, the waivers through the Relief Act, will be spent? Who collectively will decide this? So no, some minimal idea, yes. So the stimulus bill that passed this week included home and community-based services waiver, the federal match increase. However, it comes with some restrictions, and we have not seen any guidance so far, other than what's in the legislation about what those restrictions mean, what the decision-making process will be. So for now, what the legislation says is that this enhanced FMAP can be used. It must enhance, expand, and strengthen services. It cannot supplant. It must supplement. And so, we are waiting now. We've just learned this week that the Senate bill that passed did include this, but there was a lot of debate along the way about exactly what restrictions there'd be on the funds. And so we are looking forward to hearing from CMS exactly what the provisions for these funds will be. And as we know more about that, we will share that information. What is the liability for a provider whose DSP declines to receive the vaccine, but later gets COVID and infects a person under their care? So I'm going to say, in part, if you have a question about your liability, you should be talking to your own attorney and move past that piece of this. But let me say, for the last, prior to the middle of January, to the end of January, we had no people who were fully vaccinated. And in that context, there were a number of measures put in place to reduce the risk of transmitting COVID and to try and ensure the health and safety of the people who were being supported. So, and people, I know our providers are aware. I've been making visits myself. Our quality resource specialists have been making visits, and DC Health, of course, has been doing their surveys just to make sure that providers are taking those measures that are necessary. And so, at this point, there isn't a requirement that staff be vaccinated. There's not a requirement coming from Department on Disability Services or coming from the government. I'm sure people are aware the period of the research on these vaccines looked at what it was looking at was reducing risk of serious illness and death from COVID-19. And I didn't emphasize this before, but I think it's really important as we talk about people getting vaccinated. We don't see any evidence of any person who's been vaccinated in the district who has gone on to need hospitalization, become seriously ill, or died from COVID-19. They are still looking at the issue of whether people can be, asymptomatic and have the COVID-19 but not become that ill, whether they could transmit. I believe DC Health could say, I think the early evidence looks really good on all of that. But because of all of those things, it is essential that we continue to use all the other protection. The vaccination is an extra layer of protection. It prevents the person who gets it from becoming seriously ill or dying from COVID-19. It may have these other protective factors. If you have questions about liability issues, I recommend speaking with your agency's attorney. Mark might want to go beyond that, but he'd probably be the one who would have pushed my mute button if I started giving people advice.
I absolutely would. Thank you for saying that.
So if any of the providers have questions about scheduling or getting vaccine, TT has put her email and Shioma's email in the chat box. And for people who are on the phone, it is Titilayo, which is TITILAYO .Ilori, ILORI @dc.gov, and Chioma, CHIOMA ioma.nwachukwu, which is NWACHUKWU at dc.gov. In a residential home, the DSP is a family member. All of the family members in the house, including the person and the DSP, have been vaccinated. Is the DSP and the person still to follow the safety guidelines, like the DSP taking their temperature 30 minutes prior to starting work, DSP reporting their health status 30 minutes prior to starting work? So, I mean, DC Health could take this, but I think that the answer to that is the guidance has not changed.
Correct. And I will add again, as I mentioned about the previous guidance, is that in terms of quarantine, our guidance covers very specifically ICF's Chapter 35 supported living, and then also healthcare personnel, which are defined as all paid, unpaid persons that work in a healthcare setting. If in the setting that you are asking about, that doesn't fall in that, then you should follow community guidance that's also found on coronavirus.dc.gov/health guidance, which is one word, for your specific infection control, prevention, and guidance to keep you and your person supported safe. So.
This was raised in a coalition meeting, but I haven't seen or heard any official transmittal regarding change in requirements to bank statements uploaded to MCIS each month. Service coordinators are generating issues for non-compliance, but it's not consistent. There's a new place under the finance tab to upload bank statements, but it was normally only required annually or for Medicaid research. I'm hoping someone, I don't know if Winslow can answer this or if there's someone from operations who could answer this. Winslow?
So thank you, Director Reese. This is a process that the operations unit is using to ensure that people have current personal funds data in the MCI system. There has been a tremendous effort by the operations unit to revamp that system to ensure that we are keeping people's benefits recorded in a useful and meaningful way to avoid people losing Medicaid. We don't talk about this much, but we've had several people lose their benefits over the last couple of years as a result of record keeping and actual financial information not being kept accordingly. So this is from operations, and I would recommend that if people have specific questions about the process, that they reach out to Hakima Muhammad, who did a very thoughtful presentation, and her and Pam Harmon with the service coordinators today on this very issue.
I assume people may have it, but I will type Hakima's contact information. So it is Hakima, Hakima .Muhammad, MUHAMMAD at dc.gov.
Andy, just to make sure that people they weren't able to get it down, I actually put the two emails you gave earlier in as well.
Thank you. What consideration is being given to inform providers of day service options as we transition back into a non-COVID world, providers may not be aware of what programs still exist or what new opportunities may be out there. Can we plan a forum, perhaps? I know that at our provider leadership meeting, which occurs next week, we'll be talking about day services. So that would be a good place to talk about this issue and, you know, how we plan for this issue, which is still a number of months off. Just saying. Who should burial fund checks for DDS people be addressed to, and where are they sent? Winslow?
Sorry, getting to this mute button is not as quick as I used to be. So that is also an operations function with regard to the burial funds. And I would also defer to Hakima Muhammad's shop with regard to those funds. Those funds are maintained outside of DDS, but DDS is the conduit to the Department on Human Services, who maintains those checks. And also see, does what Winslow just described apply only to those for whom DDS is the rep payee? That is a very good question. But what I can say to you is all people who receive Medicaid, there is a need to ensure that they stay within the income guidelines, and our providers are responsible, our residential providers are responsible for assisting people with doing that. So this process, if you have a person where you're the rep payee, the information still needs to be in the MCI system, but I'm not certain as to whether you would need to send banking information specifically into the MCIs. So what I'll do is make sure that we have a solid guidance on this for our next meeting, and it will be posted. But I don't believe that there is much of a change for if family members are rep paid with regard to uploading information.
You can just keep reading and answering, Winslow.
Has the personal funds policy changed? Because currently it requires at least quarterly and does not require us to upload. So I'm going to go out on a limb and say that policies foundationally have within them the goal of obtaining something. And that does not mean that procedures can't change to ensure that policies are being followed. And so we may not change the personal funds policy, but from your question, I will be reviewing the procedures. And if this is not included or there's a conflict with regard to how interpretation of the procedures is being handled, we will ensure that it's very clear. This is not something we can compromise on. We have to maintain people's benefits. And the last couple of years, it has been a bit messy, and there has not been penalties specifically to providers who fail to support the person in doing so. But the penalty to the taxpayers of the District of Columbia is that local funds have been used to pay for services where benefits are there for a person, but for maintaining the, so the providers have not felt this. The taxpayers of the district have felt this, so there is a need for it to change. It says quarterly, and will the new policy or transmittal be sent out? I will have to defer to operations on that, but we'll get you that answer, Sawita. And then next it says, and issues for not uploading monthly. For those who don't know, providers are averse to issues being generated because it is a measure of our quality system. However, and unfortunately, there are instances where the best stimulation for change is a slight reminder of why something needs to occur. For the most part, we have wonderful providers who support people. The majority of people maintain their benefits, and we've worked together, but we felt that is operations that we needed to change this process. It says, but we receive statement quarterly. I'm really clear on what you mean by we receive a statement quarterly, because I'm not aware of any banks that send statements quarterly. And next, I'm trying, it must mean trying to get clarity about the burial fund. Are we to send attention to Ms. Walker or Ms. Muhammad? Please advise. I'm certain that if you reach out to either of them, they would be glad to help you. I guess, the rest of my day would not be complete if I don't say this. A lot of these questions seem to be about systems that we, our agency, has managed for years, and we've changed. And my recommendation, as always, is when you have concerns specific to operations, it's more of a probably more meaningful discussions. These forums are great opportunities to get questions out, but a lot of these questions seem to be about day-to-day operations. So my number is 202-730-1618, and I'll type it in the chat for those who don't have it already. But I welcome questions, but I think some of these questions are Monday through Thursday questions, any day of the week, and this forum is 1 hour.
Speaking of which, it is now 1:03. We started at 12:05. So last one, Winslow, you stated there was a presentation for service coordinators today. Will this information or changes be made to the provider community as well, so that we can be clear about what we're required to do?
I will ensure that if not the actual presentation, because the presentation today was more operational, specific to service coordinator, but I'm most certain that Ms. Muhammad would not mind sharing the very insightful presentation that was done today. Also see something that says, should issues be generated if a person is over-resourced due to their stimulus check? It was understood that 1 year was given to spend the stimulus check. Earlier, I posted some guidance from Melissa Bird that came out in May. I'll repost it. And also, just because this question, as I hear some of the questions, I'm really concerned that maybe we could do a better job of pointing you to where information is, because it took me 2 minutes to find this on the DHCF website and all of our providers, just about our Medicaid providers. And if these transmittals are not coming to you, then that is a concern that we will raise with DHCF. This was dated May of 2020.
And I'll just, as you talk about DHCF transmittals, I'll just mention one last issue regarding a DHCF transmittal that went out within the past week that I think is of interest to some people here. I never remember, I'd have to find the transmittal to see what DHCF calls it. But the program that is administered currently by Health Services for Children with Special Needs, where there had been a proposal to change the transition age from 26 to 21, DHCF has rescinded that decision. And so anyone who is receiving services prior to age 21 at this time will continue until to age 26. And as I said, that's a transmittal that went out from DHCF this week. We can end on that one little bit of good news for people who had concerns about that transition feeling to them was too early. So I hope everyone has a very good weekend. We will talk again next week. And as I've said a couple times and cannot be said too many times, please continue to take all the necessary measures to ensure that you, your loved ones, the people we support remain safe and healthy so that we all get through this together. Thanks a lot, and I'll talk to you all next week.